What's going on, guys? It's Nathan Humphrey, and today we'll be talking about Stoneman syndrome or FOP. I will put that on the screen. I don't want to butcher that name. A rare genetic disease where tissues like tendons and ligaments form bones outside of the skeletal system. The muscle tissue and connective tissue ossifies, also known as extraskeletal or heterotopic bones, which restricts the general movement of the bones and hampers an individual's life. Since the syndrome is genetic, the development of extra bones can be seen in early childhood itself, starting from the neck and proceeding downwards in the body into the limbs. Patients who are born with FOP generally have big, malformed toes. This is very distinct symptom as none of the other skeleton and muscle associated diseases do not showcase big malformed toes along with shorter thumbs and other skeletal abnormalities and growths. How does FOP affect an individual's life? First, heterotopic bone in any region of the body can constrain the mobility of an individual, which makes it harder to perform daily routine activities. For instance, extraskeletal in the neck region may cause difficulty in the neck and mouth movement. It makes it difficult for the patient to speak, eat, or rotate their neck freely. Second, the growth of heterotopic bones do not stop on its own, leading to more severe problems in the later sections of life. The bone that once only affects the neck and the mouth region will generally make its way downward in the body, from shoulders to backbone and further to limbs. This may put pressure on other bodily organs like the lungs and rib cage, making it difficult for the patient to breathe. Third, abnormal growths may make an individual overall body fragile and vulnerable to external damage. Any physical trauma to the muscles, like a fall or invasive medical procedure, can cause myositis, episodes of muscle swelling and inflammation. If I'm butchering the word, I'll put it on the screen so you guys kind of know what I'm trying to say. And increase the process of ossification in the affected area. In females, the heterotopic bones in limbs or lower back can make it difficult to conceive and continue with the pregnancy and childbirth. However, it is not impossible to conceive, but it is advised by medical professionals to avoid any pressure on your body to avoid any flare-ups. What are the causes of Stoneman syndrome? ACVR1 gene is found in many tissues of the body, including cartilage and skeletal muscles. It is responsible for the mapping of bone morphogenetic protein or BMP type 1 receptors. BMP is a member of the protein family which looks after the infrastructure of the whole body by maintaining the right balance of morphogenetics, cellular lineage, commitment, proliferation, differentiation, and apoptosis of various types of cells throughout the body. It's a lot of big words at you, I'm sorry. ACVR1 gene also looks after the development of the muscles and the bones, including ossification. Usually the process of ossification aids gradually replacing of the cartilage or by the bone, which is normal in the skeletal maturation of a healthy individual. Mutation in the ACVR1 gene can cause disruption in mechanisms that control the activity of the receptors. The abnormal activity of the receptors leads to more than the required ossification of the bone's morphogenetic proteins, leading to fiber disaplasm, ossification progressive. I know it's a lot of weird words, but I'm sorry. The good news is the case of viral ossification are very low. The probability of the case in 1 in 2 million people worldwide. This is because the illness of syndromes run in autosomal dominant patterns, which means that one copy of the alternate gene in each cell is enough to create the malfunctions. What are some symptoms of the Stoneman syndrome? The nature of the genetic disorder makes it easy and difficult to identify. Since FOP is quite rare and less known by the general public, one might confuse it with less severe or muscular disorders. On the other hand, its distinct symptoms make it easy to diagnose. If a person or blood is related to a person who has this rare genetic disorder, it is quite susceptible that it will transfer to their offspring. One can see it by close examination of the toes and thumbs of their newborn child. Infants with this symptom are born with malformed big toes and in some cases malformed thumbs. Other than that, here are some of the symptoms which can be shown by the child as they grow with Stoneman syndrome. Restricted movements of the joints, especially the neck and shoulders at the initial stages. Deformed spine, frequent imbalance while moving, followed by low-grade fever, inflammation, and joint pains. Surface reflection of abnormal bone growth through the body, except the tongue, diaphragm, extracurricular muscles, cardiac muscles, and smooth muscles. Difficulties breathing, eating, and speaking. Hearing impairment, this one's rare. Visible swelling in the affected areas. These symptoms will get more severe as the child grows, and the tissues not only ossifies in the upper region of the body, but also makes their way downwards to the trunk, back, hips, and limbs until a person completely gets immobilized. How to get medically diagnosed? Diagnosis of a rare genetic disease can be a challenging task. At initial stages, cases of FOP can be confused with other aggressive muscular illnesses like juvenile fibromatosis, cancer, and fibrous dyslexia. The only symptoms that make it different from other conditions is malformed big toes. So let's look for the big toes and maybe the pinky as well. The little toe, what do you want to call that little toe? I don't know. Like every other medical diagnosis, your healthcare professional will examine your medical and your family's medical history to look for any generic patterns, followed by a series of physical examination and laboratory tests. Your laboratory tests may include images testing such as x-rays and MRIs and genetic testing registry. Imaging testing will help the doctor to see the overall growth of a heterotopic bone, whereas GTR will direct the doctors to choose appropriate genetic tests for this condition. GTR is conducted by a group of medical professionals that majorly deal with research and analysis of such rare conditions, and it includes a series of questions for both patients and the medical team. What are some treatments for this? Generic disorders like fibrodysplasia, ossification, progressive do not have a effective cure till now, and since the removal of the bone will only lead to the growth of new and more painful heterotopic bones, medical professionals have come up with a couple of medications that slow down the growth and intensify of ossification. High doses of corticosteroids like prednisone, I'll put that on the screen, is to reduce pain and swelling flare-ups seen in the early stages. It is recommended to be within 24 hours of the first flare-up. Before non-steroidal anti-inflammation drugs, NSAIDs, which need to be given before flare-ups. Muscle relaxants, whatever you want to call it. Mast cell inhibitors. Then this word is like really fucking big, so I'm gonna put it on the screen for you. Assistive devices such as braces or special shoes to help with walking. Occupational therapy. One of the things that needs to be monitored in the treatment duration is things that can increase the ossification and physical discomfort. Treatments and medical diagnosis associated with bones like a biopsy, intramuscular infection or infection, and jaw stretching during dental procedures must be avoided, as it can damage the skeletal system, which can flare up the process of ossification in the affected area. Avoid getting hurt. It's not easy when your mobility is manipulated by blunt trauma, or injuries can cause a flare up in the heterotopic bones. Any physical activity that has a risk of falling and other physical injuries must be restricted. FOP can be dangerous for pregnant women and advised to avoid childbirth if you have this genetic for majorly 2 reasons. Firstly, your malfunction genetics can be transferred into your offspring, making their survival difficult for the rest of their life. Secondly, the increasing fetus in your womb can increase the rise of flare-ups, which can be life-threatening for both the baby and the mother. Flare-ups and its management. FOP patients often experience unpredictable episodes of soft tissue pain, swelling, reduced movement, stiffness, which is also known as flare-ups. Even though flare-ups can be relieved without any specific course of treatments, it needs a certain amount of management to relieve discomfort and slow down the formation of heterotopic ossification. One can easily identify FOP flare-ups by looking at symptoms like a sudden pain, redness, bumpy, lumpy swelling, stiffness, and a warmth in the affected area. Flare-ups can be triggered with daily routine incidents and activity like physical injury or exhaustion, muscular stretching, and medical procedures like intramuscular infections, dental procedures, or biopsy, or any viral or bacterial infection. You can manage your flare-ups and discomfort by avoiding trigger points and following medical prescriptions given by a doctor. Keep track of your episodes and your daily routine to have a better understanding of your illness. Also, share your concerns and track records with your doctor to get the best recommended treatment. What are the complications of Stone syndrome? Apart from pain, inflammation, and swelling, the extra bone may expand its way to the chest, suffocating organs like lung, heart, esophagus, etc. This also hampers your ability to speak, eat, or even walk in the later sections of life, and in severe cases, it can cause respiratory infections and heart failure. In a few cases, heterotopic bones can also cause curving in the spine, depending upon the growth side. It can be side to side or top to bottom. This can make it difficult for an individual to walk and perform daily routine jobs. Alright guys, I hope this has helped you in any way. If you guys know anyone that has this, or you may have this yourself, I hope this has helped you in any way, like better understand it, or just better understand the illness. I will put more helpful tips down below if you guys are interested in that. Hope you guys are doing good, you're staying safe, and you guys have been absolutely crushing this channel. I appreciate every single one of you guys. If you guys want to see like a certain disease, or like want me to talk about something in specific, just let me know down below and I will look it up and do my research on it. I hope you guys enjoyed. I love you guys. I'll see you in the next video. Stay safe.